anniversary. Over 100 days. Congratulations, folks, of enjoying your house arrest for over 100 days now. Well, it's not. That's what you're thinking, because you can be able to go and do your little shopping, is it not? Yeah. Over 100 days, folks. And yeah, still can be able to see your loved ones. Still can be able to go see your mother, your father, your brother, your sister. We come a long way. And just in the news now, I've just seen an article that states that we might go to level 5. Can you believe it? Level 5. You know? And here's another article. Fresh article, folks. From the Times Live on the 1st of July. Our healthcare system is overwhelmed. Eastern Cape Premier's SOS to Cyril Ramaphosa. It's penned by Bongo Jacob. Listen to this. One of little excerpts. One hospital that needs intensive care is Cecilia Makiwani in Mdantsane, which only has 2, though another 12 are expected to be added. Mbengashi told Dispatch Live the situation was worse in rural hospitals. The 3,000 ICU beds needed was based on scientific evidence and not a thumbsuck. He said, out of 100 people who contract the coronavirus, 20 were hospitalized and 5% were so sick they needed to be in ICU. Listen to this, folks. The Provincial Health Department had 220 ICU beds before the pandemic. 300 were added after March. And now the department is still trying to get some more. Okay? So, it's a mess. Over 100 days. The generosity of the people of the Republic of South Africa listening to our government and staying at home. Well, you know, it has not been honored and been respected. Because now you're having provinces that they're saying they are being overwhelmed. We're in the month of July. We're still going to be in the month of August, where more people are going to be hospitalized, as this is flu season, as we all know. So there's just going to be pandemonium and chaos. Where is alcohol to blame again? We must start blaming alcohol again now and say we've been overwhelmed. They should have just said that we have been overwhelmed here in the Eastern Cape because of more people are drinking alcohol and there's no space. But hey, thanks for their honesty, you know. We've been governed, folks. We are being governed. And the sad part about this, as we speak right now, the ANC government has failed to pay their staff month end of June. Okay, the ANC government promised to pay their staff. This is the ANC political party, in fact, not the Republic of South Africa government under the ANC, just the ANC itself, the political party. Okay, it doesn't have money to pay its staff. So the staff is paid on the 25th of every month. They received an information or a notice that there's going to be a delay in terms of payment for a week, and then they had another delay of payment. Okay? In one of the article, it states that they just said that their treasurer is having a bereavement in the family, which is, you know, sad news always to hear of someone losing their loved ones. But apparently that was also put in the email that was sent to the staff, and I beg your pardon. And yeah, and also they were told to wash their hands and follow their social distancing, you know. And one of the other reasons stated was that it's because of the crisis of this virus, you know. That's why people are not getting their salaries. Remember, folks, the previous December holidays, ANC staff also had delayed payment for their Christmas payments. They didn't get the money. So if you still have hope that you're in good hands of a government which is going to be taking care of you fighting the coronavirus vigorously, whereas they cannot be able to pay their staff, then you've been duped, folks. You've been duped greatly. You've been duped greatly, and this is one of the sad indictment about what's been happening. And then what have we achieved now? Then there was a gentleman also who died in the hospital after not having food for over 48 hours. Okay, he sent an email, rather a tweet, to our Minister of Health that I'm not getting food. Yes, the gentleman's name is Shonisani Litole, the one who has sent a tweet to our Minister Mkhize. May his soul rest in peace. Died in a hospital without getting food for 48 hours. You know? You can imagine if you're not having food for 48 hours while you're healthy, you know, how you're going to be affected. But it's hard to imagine how it would feel for a person not to have food for 48 hours while they've got the coronavirus. And the big question is, our Minister of Health, I mean, he must have a staff. Obviously, he's got several followers on his Twitter feed, obviously, you know. He might not have seen it, but I mean, he's got staff. He's got staff in his ministry who would have then seen it, you know. Just to confirm here, Dr. Zweli Mkhize has about 444,000 followers. Fair enough, understandable. But somebody could have just picked up the phone and said, we have a South African who has COVID-19. He's in a hospital. He said he hasn't received food for 48 hours. Something has to be done quickly, and we should get to the bottom of it and make sure that whomever is responsible for this will be momentarily fired while you're doing the investigations. Because you know how the government likes to say, we're still conducting investigation. I don't know how much money we have spent in terms of investigations. You know, the money that we could have used for service deliveries. You know about it all, the acid money, denials first, and then committees being set up, commissions being set up, and millions and millions and millions of taxpayers' money then would have been used after that. you know. And this is not the first situation of somebody who's having COVID, having been mistreated. I remember there was a story of this lady who appeared in the news, one of our news channels, how they were just knocking at the door and putting food next to the door, you know, where she was just vigorously trying to get some food and was not getting help in due time. So we got some serious problems that we have to deal with in terms of our health system. You know, our health system has been in bad state before the coronavirus, you know, all the way up to now. So we can't even blame the coronavirus now about the state of our health system. And remember the doctors, the Cuban doctors who has come over here in the Republic, as to how much money is going to be spent on them. Millions, hundreds of millions of rands are going to be spent on those doctors. Our health minister stated that they have some of the skills that we do not have, you know. So I guess that's yet has to be dug out by anyone who cares to find out as to whether this is true, you know. Trust but verify, you know. 9 out of 10 you've just find out that the same skills that our Minister of Health is purporting that we do not have here in South Africa, you just find that we do have those skills, you know. Speaking of Cuba, the latest news now is that Cuba is facing food rationing. So a word has come out to the Cuban government servants, as they like to call themselves, the authorities, that people must start now having to grow food into their houses. You know, these are the benefits and the goodies of communism, suffering and so forth. But at least for now, they've got an excuse now. So they will just talk about the embargo that Trump has now reinstated in Cuba. So it's all bad. This is what has been happening in the last over 100 days of lockdown. Our economy has, obviously, in terms of the tax revenues, over 300 billion in terms of losses that we're going to be needing. Our GDP debt ratio skyrocketing. Our economy contrasting. So our economy is going way down. I think the stats are that it's going way down by 7%. And remember, we are on 0 point something percent. So minus 7% of 0.7 or 0.8% is just the total base. We're not growing, as a matter of fact. So these are the hardships that we are going to be facing. On the other hand, maybe one of those pressures that are constantly endured by the government. Also, it's a statement that came through from the economic freedom fighters, who are saying, let us close, which is ironical, let us close the economy, let us have level 5, and everybody must go back at home. The government's going to be giving us the goodies for the next 3 months. You know, suggestions of the banks not having to collect anything for 3 months. Private hospitals being nationalized, you know, in a communist utopia, Kombaye situation that we're having, you know. So that's what's been happening. And as we speak right now, the issue of livelihood has just come afore, Almost everyone I know, everyone I give a phone call to, they say, hey, I have received 50% of my salary. I'm waiting for the UIF payment, and my company says that, the government is just delaying them. They said that they'll give them the UIF, and that's just the situation that's happening now, And there are also news cropping up that seems as if the government is running out of the UIF money. Oh, by the way, also the big promise of everybody be getting their 350 bucks. Also, in where I come from and the conversations that I'm having, for all those people who are not working, they're not getting that amount, But I guess it's also a public relation, The ANC can just use it, rally around to get their voters base, because they net a whole lot of rural votes. So if they keep up that promise again, it will be a nice rallying cry for them to say, guys, we've given you 350 rands for over 3 months, the money that we didn't have, and they probably then get voted and win again, So it's been bad. One can just hope that sanity will prevail, and obviously there are statistics that President Ramaphosa has spoken about when he was giving answers in his questions and answer session as the President of the Republic, about the numbers of hospitals and hospital beds that they've put out, But clearly now, as we can see, the provinces are now starting to cry out about how unprepared they are, So we'll see. The last thing that the government could do now is to start thinking about closing businesses down, This is, we haven't seen nothing yet in terms of people being laid off their work, And in most communities, one person is a breadwinner to like an average of like 7 people in the house. So, the West is yet to come. So the only thing that the government can really try to do now is to make sure that they stop the bleeding in terms of loss of work. So this is just my take on our 100+ lockdown, house arrest due to this pandemic that we're experiencing. Thank you for watching the Mamuji Show, and I'm out.